want to say hello to everyone in Hobart. Thanks for joining. And hello to everyone in Melbourne. So that was an amazing talk by Derek. I was just listening to what he was saying, and this whole multidisciplinary approach to things. You know, I've been practicing as a consultant for over a decade now. And when I first started out, I had this little narrow view of the world and my practice. And, you know, you sort of, when you've got a hammer, everything looks like a nail. That's true in surgery as well. You know, we were trained only steel can heal. What are you showing me CT scans for of airways? But, you know, that sort of opened my eyes a little bit. And the TMJ is something I have as well. And I have severe sleep apnea. So this is very personal to me, but sort of I learned a lot from Derek. And now I see patients through I guess, an airway view as a dental thing that you guys do. And as ENT surgeons, you know, our kudos is we manage the airway. We're the surgeons that you call on. Expectations were unrealistic. And it's the same with children as well. You can tell the parents that like we can, you know, create more airway. But if you imagine this is a house, you've got a very narrow house where it's like a tent. And you can take furniture out of the house. You don't want to take out too much furniture, otherwise you know that causes problems. But you're still left with a narrow. But introducing you know, dentists with an airway experience that you can just rely on, orthodontists for the, you know, yes, they're the borderline ones where I might consider doing oximetry or a level 2 sleep study in a child, but the vast majority, it's a clinical diagnosis, and, you know, you can learn anything if you take an interest in it. So I would say that you guys are actually changing, you know, you guys, I'm seeing a shift even the last 5-10 years, like dentists are becoming the experts in airway, and particularly in children and in snoring adults. So I think it's increasingly prevalent, and I don't think it's a diagnosis just for naughty kids. You know, that's like really oversimplified, you know, like wrong way to look at it. I think it's a neurodevelopmental sort of disorder. But the funny thing is that there's a lot of overlap with ADHD and OSA, and the incidence of OSA in these kids is probably higher than in the normal population.